The bodyweight glute bridge is obviously an exercise that, due to the intensity of it, isn't going to be able to add a great deal of strength. However, if you do it in a specific way, it can be very, very effective for priming the body and creating a sensation which then you can carry onto your lifts, which will be very, very useful for recruiting the right muscles and keeping the spine as safe as possible and ingraining spinal stability. So here you can see that I have my head and my shoulders against the floor. The heels are level with the glute line, so the middle of the glute is level with the heels, with the feet just slightly turned out to the side. Now what I've done here is that I've now put my hips up and then tilted. Now I've purposely done in the video, you see how I have my thumb on the bony part at the front of my hip, and I'm tilting my hips to create what's known as a posterior tilt. So I'm basically bringing my pubis, so bringing the pelvis up towards the rib cage, contracting the ab muscles, so the rectus abdominis, and making the lower back longer. So I'm really trying to ingrain that position there. Now I'm in this position, I want to, what I can feel to know I've created this posterior tilt is a stretch on the front of the thighs. So between where the knee is and the top of the thigh, if we look at the muscles around here, they should be really tight in this position. You should have a good level of engagement in the hamstrings, and you should be able to feel your glutes engage as well. Now what you're going to do in this position now is put your hands out to the side. You're going to take a really deep inhale through the nose, and then you're going to exhale, really looking to contract and hold this position here. Now the reason that you want to be doing this is that you want to be able to create a strong contraction to pull your rib cage up towards the pelvis, so you're engaging this rectus abdominis. So you really want to engage those abs there. That's going to pull the front of your hips up towards the rib cage, and now we're going to inhale and breathe through the nose and really engage this pattern. So it's inhaling as you go back, exhaling as you're coming up, looking to connect the rib cage to the front of the hips. Whilst you're doing this, when you're going back, I want you to inhale into your nose and imagine you're expanding the lower back, so getting as much air into the lower back region and getting as much expansion as you can here. You're going to hold this position, and simply by keeping this glute bridge and doing these crunches with the inhalations and exhalations, you'll start to see a good level of glute recruitment and those waking up there. If you feel that one side is engaging more than the other, then you may need to play around with the way you load your heels, so loading your feet equally, get an even distribution between both heels, or alternatively you can move on to the next exercise, which is the single leg glute bridge.
So with this single leg glute bridge, the idea here isn't to strengthen the movement, because if you think about this logically, this body weight movement is not going to provide enough of a stimulus to the muscles and the structural system in order to actually strengthen this glute in comparison to doing a hack squat, a deadlift, or any type of hip hinge movement. What it can do is create a pathway from the brain to these muscles as a way of utilizing this muscle, or the glute, as a hip extensor prior to doing the movement itself. So think of it as waking up the muscle rather than actually strengthening it. So the way we want to do this one is, first of all, having your foot firmly on the ground, making sure your heel is centered, so the weight is through the center of the heel and it's lined up with the midline of the gluteal. So basically where the bony part of the hip is, you want to align that with the heel. We're then going to tuck the hips posteriorly, which basically means we want to make the lower back long. We're going to inhale as we prior to doing the movement, and exhale as we drive up. We want to create this complete straight line where we have the knee, so where the femur goes into the hip and into the shoulder, exhaling as we drive up without going to any extension in the lower back. So we want to tuck, engage the hamstrings, so really pull them into, so they pull down at the hip, keep it intra-abdominal pressure in the midsection and driving up. So we want to inhale as we go down, exhale as we go up, doing this evenly per side. Now it's very, very normal to feel a very intense stretch in the rec fem hip flexor area. That's something we want to maintain, as putting this stretch position is going to ensure that we're getting a good contraction in the glute. So remember, intra-abdominal pressure, weight through the heel, inhaling on the way down, exhaling on the way up, doing this for maybe 2 to 3 reps until you feel even contractions in both glutes.